There are a lot of unknowns associated with the COVID-19 outbreak, and it can test anyone's mental health. In Focus on Your Health, Teresa Snow shows us some tips for reducing anxiety and helping your family through these uncertain times.
Focus on Your Health is sponsored by MU Healthcare.
Joining me now is Dr. Laine Young-Walker, Chair of the Department of Psychiatry here at MU Healthcare. What is causing all of this anxiety during this time?
There is an increased level of anxiety because of the increased level of uncertainty. People don't know what is going to happen from moment to moment. They wake up and turn on the news and see stories about things that seem horrific to them sometimes, and that may increase their anxiety.
And it affects their economics, their family, their routines.
Yes.
There aren't answers. What do you do when there just isn't certainty about the future?
So when you're in an environment where you can't really create that certainty about all of these different things, there are some things that people can rely on and move to. There are some recommendations that are clear about what families can do and people can do to stay safe. And so they can try to create a new normal in their environment that incorporates those things that help keep them safe.
They can have assurance that if they do those hygiene practices and such, that they are taking the best recommendations and taking action.
Right. And so as we get guidance on things like hand washing, social distancing, then being able to then implement those things are things that are certain. If I do these things, it will reduce my risk. And that will help, I think, some of the anxiety.
What about children? What should we be talking with our children about, and what about their routine? Because so many of them, that's really been disrupted.
So now that many children are out of school, that is a big part of their daily routine is the school life. And so it's important for families to come together and create structure. Many schools, they're not physically there, but they're remotely learning. So there's a way for them to set up some specific times that we're going to work on your work, and then other times that we're going to do other things. And so in the family, they can create the structure, the consistency for those children to help them to move forward. And I think the most important piece is communication. You know, they may have lots of questions, and it's important for the parents to be able to listen and respond and be honest. Some of the answers they may not have, but to be honest about that.
Are you concerned about mental health needs long into the future after we're past this initial wave?
So there is a likelihood that when we finally are through this and people feel physically safe, that at that point you may see an increase in reports of anxiety and depression and things like that. We're managing mental health issues even in the present, and we need to be able to continue to manage those even after that.
Briefly, a silver lining, do you think the coming together might be positive for some families?
So there's routines and habits that people have. It may be we go to the movies and out to dinner every Friday. Well, now you can cook dinner as a family and you can watch a movie on Netflix together. And so it brings you in the home environment where maybe you might have been separated from others and done things as a couple. Now you can do it with your entire family.
Could be positive, we hope.
Yes.
Thank you very much. And with Focus on Your Health, I'm Teresa Snow.
Focus on Your Health has been sponsored by MU Healthcare.